Hello everyone, I'm Kibin Alleyne and today is Tuesday, January 23rd. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In recognition of World AIDS Day, the Montefiore AIDS Center received $6.8 million to mitigate the disproportionate impact of HIV on Black, Hispanic, and LGBTQ+ communities. The medical director for the Montefiore AIDS Center, Dr. Barry Zingman, joins me to discuss how this funding will amplify prevention and treatment programs in the Bronx. Doctor, thank you so much for joining me.
Thank you for having me.
Now, can you provide an overview of the Montefiore AIDS Center and its role as one of the largest HIV prevention and treatment programs in New York State?
Absolutely. The Montefiore AIDS Center has become a comprehensive program for people at risk for or living with HIV. We've designed our services to really be supportive of people in their sexual health lives, people who are trans, non-binary, or LGBTQ positive, or people who are living with HIV. And we provide a full set of holistic services to support people and to live long and healthy lives.
Now, as I mentioned recently, the Montefiore AIDS Center received $6.8 million by the New York State and the NYC Department of Health. Basically, can you just explain in what ways is the funding crucial to address the impact of HIV?
Sure. We are so appreciative of the New York State Department of Health and New York City Department of Health to support the comprehensive care. And what these grants go for is it's three different grants. One is from New York City Department of Health, is aimed at people not living with HIV, people who are sexually active, people who are LGBTQ plus, and it helps them to be tested for STIs, sexually transmitted infections, to be treated, to be supported in going on to treatments to prevent HIV, so-called PrEP, PEP, and also really critically important for people who are at risk for STIs and HIV is to support them for other factors that may increase their risk. So, for example, if they're having mental health problems, if they're having substance use problems, if they're having insecure housing, food insecurity, all of these things contribute to risk. And so this grant helps us to address those with staffing that can help them to assess where they're at and help them get to a better spot. Yeah. And then there's two other grants. The two other grants are aimed at people living with HIV, also to provide them with comprehensive supportive services. One is aimed at young people, young LGBTQ individuals, ages 16 to 30, and that's at our Oval Center site. And the other is aimed at older individuals living with HIV at our Center for Positive Living site. All these grants provide us, allow us to have staff who can help patients with overcoming barriers to getting into care, help with insurance coverage, help with adherence to medications and treatments, help with education, which is critically important, and we help them to support them with what I was mentioning before, what are so-called social determinants of health. So things like housing and food and employment and education, that all of which, if there are difficulties in those areas, they can lead to increased risk.
Right. Now, I also want to highlight the fact that, as mentioned, it's focusing on LGBTQ+ communities and BIPOC communities. What are some of the unique challenges and health disparities faced by these individuals in the Bronx that prompted Montefiore AIDS Center to tailor its services to meet their specific needs?
Okay. I'll say first that we've been able to, with these grants and with our amazing staff, we've been able to be very successful at meeting the needs of those populations. So these groups, as is really well known, often aren't well tied to the medical system. They may not have a primary care doctor. They may be distrustful of the medical system that has historically often treated them not so well, not treated them with equity, provided them with the expert care that they need and deserve, and the dignity that they need and deserve, and And in most medical settings, those social determinants are something that the patient has to deal with on their own. But for BIPOC and LGBTQ communities, they often need help with these. To overcome these, there may be language barriers, there may be distrust barriers, and so they need help with overcoming these to get to that better spot.
Now, how does Montefiore envision more equitable HIV prevention and treatment outcomes in the Bronx?
So basically the way I described it. So if you can provide a safe and affirming place where people know that they're not going to be judged, that they're going to be treated according to who they are and where they're at, and that they're going to be provided with things that they didn't even know that a healthcare institution could provide to them, like phone calls a week after coming in, like how you doing on your medicine, like help with insurance, like help with actually getting your medications, help with housing, other things, so, help with education to understand that if you're coming to us for the possibility of a sexually transmitted infection, that you actually may not even have thought of the fact that you're at risk for HIV and really should be talked to about HIV prevention as well. And you may come to us because you're LGBTQ plus and not know where you can get gender affirming care. And we offer that as well on site. So people come to us and don't really realize the range of services they can get that and how welcoming it is.
Now, something you mentioned was the social determinants of health, and that is a term that I've been hearing a lot more lately, especially as I have these types of conversations with more health professionals. Can you expand on that a little bit more for those who may not understand? Because I think that, especially when we're talking about this type of healthcare, people often think that it's solely your behavior or your actions that determine your health. So can you just expand a little bit more on the social determinants of health?
Sure. So there are certain categories of needs that are said to be social determinants of health. Some of these categories, and these categories are things that affect people's lives in such a strong way that they can no longer access health care well. And so, for example, lack of employment or underemployment. If you're not employed, you may not have an income, you may not be able to afford childcare, you may not be able to afford to take a day off to come to clinic, you may not have benefits, you may not have insurance, you may not be able to afford the transportation to the clinic. So same with education, with housing. If your housing is insecure, then medical care is not the first thing on your mind. Each of these things snowballs. So the person themselves is not accessing care. If they've been exposed to a sexually transmitted infection, then they're not accessing care, they're not getting treated for it, they may be passing it on to others. All of this snowballs, and if you're living with HIV, then you may not access the care you need, and then your HIV may just get worse and worse, and you may transmit it to others. And so these are absolutely critical supports that we've learned over decades are really the critical things for many people to be able to span the gap from what do we know works, what do we know is efficacious to treat something, but why are so many people not getting these treatments? Why are so many people not, and it's social determinants of health that is really that gap.
Thank you so much for kind of explaining that and clarifying that. Now, looking ahead, what milestones are anticipated by the Montefiore AIDS Center with the new funding?
Okay, thanks. So we've been very pleased that we are we're seeing new patients every day, every month. One of the milestones we're looking for is whether or not people are being treated, whether or not they're coming back, whether or not they're taking medications, whether or not they're bringing in friends and family, whether or not they are satisfied with their care, whether or not they're accessing gender-affirming care if they're trans or non-binary, whether or not they are achieving some of those endpoints with social determinants, and hopefully whether or not they're staying HIV negative because they're being treated for STIs and they're accessing HIV prevention treatments. If you're HIV positive, then the number one goal medically is to have a so-called undetectable viral load. So where the virus HIV, when we test the blood for it, it is down to zero. It is not active. So that's a major goal. And if people living with HIV have an undetectable HIV viral load, they may live a normal lifespan.
Now, how often should someone get screened for HIV? And on top of that, where should they go?
Okay. Well, they should come to us. No, but there's many places. So that's the most important thing, is actually just going to get screened. How often to be screened for HIV depends on a person's individual risk factors. So somebody who's not sexually active at all should just get a single baseline HIV test, and that may be fine if they're not sexually active at all. But somebody who's frequently sexually active, particularly somebody who may have multiple partners, may or may not be using condoms, has had sexually transmitted infections in the last year or two, they should be getting tested for HIV potentially up to every 3 months. And so people who are taking HIV prevention treatments, we are testing them for HIV every 3 months. We're also testing them for STIs as well that frequently. And so it's a range depending upon a person's risk. You know, if somebody hasn't been sexually active and then last week went to a party and was, then they should be tested for HIV and sexually transmitted infections if they have any symptoms, or at least about 4 to 6 weeks later.
Now, where can people go to learn more information?
So there's so many places. Luckily, there's so many places. So there's local health clinics. There's the Montefiore AIDS Center and its clinics, the Oval Center and the Center for Positive Living. The CDC has wonderful information on their internet site. New York City Department of Health, New York State Department of Health. There's wonderful information out there. But some of that isn't necessarily accessed in the language of choice, and so often you can get your best information from your local clinic if they have the staff who are there to meet these needs.
Well, Doctor, I want to thank you so much for joining
Great.
us and educating our community.
Thank you so much.
If you would like to learn more about the Montefiore AIDS Center's work and their efforts, please go to their website at www.montefiore.org/HIV-AIDS. Don't go away. We'll be back with more Open right after this.